In this video, we're going to cover the models that are used in telehealth. There are primarily three models that are used in telehealth. The first one is the hub and spoke model. The second one is network of networks model. And the third is the fully distributed network. We're going to talk about these three models in this video. The hub and spoke model is a very common model used in telehealth. And the way that this works is that you have a main campus or a hub as depicted here in the slide. This main hub is going to receive the heaviest investment in its resources. It's going to supply the most intensive medical services. So think of things like intensive specialty care that might not be available at other sites. This main campus or hub is then complemented by what we call these satellite campuses or these spokes, which are depicted here in this figure as these black little circles. And notice that these spokes kind of come off of this hub, which is in the center. These spokes offer more limited services at the sites that are kind of distributed across the market. So the basic healthcare needs of individuals are addressed locally through these network satellite facilities or spokes. But in cases where someone might need more intensive medical interventions, those patients are then routed to the main campus or the hub for treatment. So the satellite campuses offer more limited services, but they actually route patients needing more intensive services to that hub for treatment. The hub and spoke model is a highly scalable, efficient design with satellites being added as needed or desired. In cases where spoke to hub access proves impractical, additional hubs can be developed. This is an example of a hub and spoke model that actually is used in Louisiana. And if you want to read more about this specific example of how a hub and spoke model is used, you can click on the link to the article here and read through that. But this figure shows a map presenting the Willis-Knighton Health System's hub and spoke network. And what you'll see here is you'll notice that in the center of this, you have this green shape here. That is the actual hub. So that is where people are going to be able to access more intensive specialty care services if they need it. That hub is going to provide the most intensive medical services for that market. The red circles and those blue squares, these are the spokes. These are the satellite campuses. These satellite campuses offer more limited services compared to the hub, but can leverage telehealth to get patients who need more intensive care through that hub. And this model we've seen is particularly important for like rural communities who are considered to be medically underserved areas with extremely limited healthcare services, particularly those resources around specialty care. So it might take patients in some of these rural areas who see, these rural hospitals as depicted by these dark blue little squares here. You notice that these are really far away from the more populated areas of Louisiana. And so this is really important because, telehealth is bridging that gap in care. It might take patients in these more rural areas hours to travel to a medical system or a hospital with more intensive service options. And so telehealth really helps them bridge that gap in care and allows individuals in rural areas to connect with more resource-intensive services. The second model we're going to cover is called the network of networks. This is really basically a model that has been expanded upon from the general hub and spoke model. And it really has expanded reach to include additional partners. So things like community health centers, private practices, school-based health clinics, and other types of traditional and non-traditional health facilities. These healthcare facilities begin to connect to each other, creating a network of networks. So before in the hub and spoke, you kind of just saw this hub in the center and then these spokes all around. But now you see kind of a more integrated network. You've got networks within networks. Some examples of these include students in school-based health clinics connected via telehealth to receive primary care from a clinician at a pediatric practice, patients at a community health center who are then connected via telehealth to a psychiatrist in a hospital. So again, this model really goes beyond a single hub with spokes, and it really is kind of this multiple hubs and spokes that are connected to each other. The last model we're going to cover is called the fully distributed network. This is really centered around this direct-to-consumer evolution that we've seen in telehealth services. So when you think of the previous models, you're thinking of a hub, which is some sort of, larger medical center or system that has a lot of resources. It's really resource intensive to deliver things like specialty care, and then you've got that connected to these other spoke sites, right? So it's kind of one clinic or healthcare center location connecting to another healthcare center location. In this fully distributed network, it's a little bit different in the sense that it has expanded reach to actually reach that patient where that patient is. So that patient could be at home, that patient could be at a school, that patient could even be on vacation and need to get in touch with a healthcare provider. But it's really focused on where that patient is and connecting that patient to healthcare services through telehealth. That patient no longer is required to go to a specific location. They don't have to be in a medical office. They don't have to be at another healthcare system office or location to be able to access those telehealth services. So those services in this model are going directly to the patient and physician or the healthcare provider, whoever it is that they're talking to, from that patient's location. This is also referred to as virtual care or care anywhere.